Good afternoon, everybody. Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. As always, Dr. Hinshaw will provide a brief update and then we'll open the floor to questions. I'll now turn it over to Dr. Hinshaw.
Thank you, Zoe, and good afternoon, everyone. I apologize for today's delay. There was a technical issue that resulted in needing a bit of extra time. I would like to start today by recognizing Albertans in Edmonton, Calgary, Lethbridge, Fort McMurray, Grand Prairie, and Red Deer, and all enhanced status areas for quickly adapting to the new measures that came into effect on Friday. I know that this was not an easy weekend for many. Whether you arranged for your employees to work from home, or temporarily closed your fitness studio, or your hockey game, yoga class, or choir practice was cancelled, or you participated in a wedding, funeral, or faith-based service virtually instead of in person, or you postponed a movie night at your house with friends or a birthday dinner with extended family. Thank you for taking action and embracing the importance of making these sacrifices. We did not make the decision to implement these measures lightly. After implementing new measures on Friday, we heard from several faith leaders who quickly rose up to protect the health of their communities. I'd like to recognize the Central Church of Christ in Lethbridge for installing new plexiglass barriers, and River West Christian Church in Edmonton for moving to online services, and all those who did not tell us what they did, but did remarkable things to protect their communities. Both of the examples I mentioned responded to the enhanced measures and made decisions that were right for them and their congregations. As I've said before, there is no one perfect approach to COVID-19, but there are many ways to step up to the challenge and protect our communities. I know this next while will be challenging, but as we have seen with recent numbers, and will see with today's, it is critical that we all continue to do our part and look at changes that we can make to our daily lives to reduce transmission. One way we can do this, as I have stressed many times, is to stay home when sick. We have had too many cases result from Albertans going to work with symptoms. We continue to encourage employers to work with employees to make sure people stay home when they are not feeling well. But I know this is difficult for many. Albertans have bills to pay, and staying home can feel like an out-of-reach luxury. So I want to remind Albertans that there are supports available. The Canada Recovery Sickness Benefit gives income support to employed and self-employed individuals who are unable to work because they are sick or need to self-isolate due to COVID-19 or have an underlying health condition that puts them at greater risk of getting COVID-19. If you are eligible, you can receive $500 for a one-week period. The Canada Recovery Caregiving Benefit gives income support to employed and self-employed individuals who are unable to work because they must care for their child under 12 years old or a family member who needs supervised care. This applies if the child's school, regular program, or someone's facility is closed or unavailable to them due to COVID-19, or because they are sick, self-isolating, or at risk of serious health complications due to COVID. If you are eligible, your household can receive $500 for each one-week period up to a total of 26 weeks. Both programs are available through the Canada Revenue Agency, and more information is available on their website. Turning to today's numbers, over the past 24 hours, we have identified 860 new cases of COVID-19 and completed just over 12,000 tests. This means our provincial positivity rate sits at about 7%, and our active case number has risen to 10,031. There are 264 people in hospital. Of those, 57 are in ICU. These numbers continue to be concerning. While we have spoken of Edmonton's hospital capacity and surgery cancellations, I want to stress that this is a concern across the province. Since my last update, a new outbreak has been declared on a unit at the Queen Elizabeth II Hospital in Grand Prairie, where 2 healthcare workers and 1 patient have tested positive for COVID-19. In addition, the outbreaks at Chinook Regional Hospital and Bow Island Health Centre in South Zone were declared over on November 14th, and the outbreak on the cardiac unit at Foothills Medical Centre has also ended, with operations on this unit returning to normal. I have heard questions about how our COVID hospitalizations and ICU numbers compare to the increases we see in influenza seasons, and why our current acute care burden is so challenging. It is important to remember several differences between COVID-19 and influenza. An illustrative example is that we have had 49 acute care COVID outbreaks in just 7.5 months, with 42 deaths linked to these outbreaks. This is despite extraordinary measures to prevent spread in the community and in the hospital. This is far worse than the worst acute care outbreak numbers related to influenza in the past 5 years. 40 outbreaks with 13 deaths in a full year. COVID is more dangerous than influenza, both at an individual and population level. Other differences between influenza seasons and what we are dealing with now include the extraordinary measures that are needed in order to prevent spread in hospital. These processes enhance safety, but also limit capacity, including much more aggressive isolation policies, where patients who have any symptoms that could be COVID, patients with confirmed COVID, and patients who have had a COVID exposure need to be in an isolation space. This means not regularly using multi-bed rooms, more widespread use of personal protective equipment, which takes time to properly put on and take off, and other changes that limit the number of available beds for use. Another big impact on capacity is staff availability. With the strict isolation and quarantine requirements for COVID that are necessary to protect acute care and prevent spread in all settings, staff who have been exposed to COVID, staff who have symptoms that could be COVID, and staff who have COVID are not available to work. As community transmission increases, more healthcare workers are exposed in various settings, or perhaps have family members exposed. This impacts the system, as services cannot be operated without skilled workers to provide them. Finally, the volume of continuing care outbreaks impacts acute care, as patient transfer from acute care to continuing care is limited when outbreaks are underway. This is not an influenza season. This is a global pandemic that requires each one of us to pull together to protect our communities, families, and friends. Sadly, I must also report 20 new deaths over the past 24 hours. These are not just numbers. These are people. As our cases rise, our deaths will rise. Every time I speak about deaths, I offer condolences because each one of these people will be missed and mourned. The measures in place right now are literally a matter of life and death, and the choices Albertans are making now will determine our future in a few weeks. Turning to schools, there are currently active alerts or outbreaks in 309 schools, about 13% of all schools in Alberta. Currently, these schools have 1,046 active cases in total. This number includes 65 schools that are currently on the watch list. So far, in-school transmission has likely occurred in 151 schools. Of these, about 79 had only one new case as a result. I commend schools for the work they do each day to keep cases as low as possible, and I know parents, students, teachers, and staff continue to be concerned. As children can mimic adults, and parents know this happens at inopportune moments, our schools mimic what is happening in the community. This means that when we drive community transmission down, we will see this reflected in school numbers. So if you know a teacher or a student going to school each day, think of them as motivation while you recommit yourself to public health measures. These rising numbers that we are seeing are straining our system in many ways. One of these is the challenge in contact tracing, as each case on average now has about 15 close contacts within their infectious period. That means with about 1,000 new cases a day, there are about 15,000 people every day who are new close contacts. It is impossible to make phone calls to each one, which is why AHS has changed their processes and is using technology like the online portal to speed up this work. Since AHS launched this portal on November 12th, about 25% of notified positive cases have used it to enter close contacts. Thank you if you are one of those people. This is a good start, but we need to do more. I understand that getting a positive test result can be overwhelming, but please follow all direction from AHS for sharing your contact information. They have made it easy and it is anonymous. Your information is not shared with the close contacts you enter in the portal. Another crucial element of the text message contact notification that the online portal enables is the need for contacts to respond to AHS to let the team know if they are symptomatic, a healthcare worker, both, or neither. If you receive a text from AHS notifying you that you are a close contact of a COVID case, please note the response options and take the time to respond with the option that matches your situation. This is critical to helping AHS prioritize phone calls where they matter most. This will make a huge difference in how quickly we can notify close contacts and prevent further spread of illness. While numbers are rising, this does not change the good things that are also happening. For those in our communities who are recognizing Diwali, I want to thank you for adjusting your celebrations this year. I know gatherings with friends and relatives and enjoying meals together are a large part of this holiday. Everyone's holidays and special occasions are looking a little different this year, as we know that social gatherings continue to be a large driver of active cases in the province. But that does not mean that we cannot still find joy in holidays or appreciate the meaning of them. Regardless of our individual beliefs, one thing that we can all take away from Diwali is that light always overcomes the darkness. I know that right now, many are feeling the darkness of COVID-19. It is concerning to see increased numbers in our neighborhoods or outbreaks at our loved ones' continuing care center or school. It is frustrating to have more restrictions in effect when we feel we've already missed out on time with friends and family. And when we've done our best to follow public health measures, but don't immediately see results, we can lose hope. But hope is not lost. As I have mentioned before, there is a lag time between our actions and their results. If we all follow public health measures, along with any additional restrictions in our communities, we could start to see results in the next 1 to 2 weeks. So for the next 2 weeks, I encourage Albertans to redouble their efforts. Stay home if you are sick. Wash your hands regularly and don't touch your face with unwashed hands. Maintain distance from those outside your household and wear a mask when you're in indoor public spaces. Now is not the time for parties. If you are in a community under enhanced status, it is imperative that you do not have unnecessary visits from those who do not live with you. For those not in enhanced areas, remember, smaller is better when it comes to gatherings. We all need to do our part. We have great power when we work together. We are seeing this in our influenza numbers this year. We have called on all Albertans to do their part to support our health system by getting their flu shot. And you have answered that call. More than 1.1 million Albertans have already been immunized, compared to about 940,000 at this time last year. This is incredible, and what is more encouraging is the successes that we are seeing. As of today, we have not had a single laboratory-confirmed case of seasonal influenza, and therefore no hospitalizations or deaths related to influenza this season. Overall, in the 2019-20 season last year, we had 8,470 lab-confirmed cases and 41 influenza-related deaths of individuals who were hospitalized. I hope that you see this as some light in the darkness. These results of record vaccine uptake and no cases demonstrably show the power of working together. There is no way around COVID-19 without this same power of collective action. We must continue to work together. Thank you, and I'm happy to take any questions.
Okay, we'll now go to the phones. Please limit yourself to one question today. Operator, please put through the first caller.
Thank you very much. The first call is from Rick Bell, Calgary Sun.
Good afternoon, Dr. Hinshaw. People are hearing from a lot of voices, particularly in the last few days, who are advocating a circuit break lockdown, 28-day one. The head of emergency in Calgary was advocating that on the weekend. The mayor has talked about how unbelievably bad things are. So perhaps you could talk about what your thoughts are about these people who are insisting that the time is now, today, right now at 4:55 p.m., to institute a 28-day lockdown, and why are you not advocating for that lockdown? I'm going to sneak this in as well. Does the hospital system have more capacity to accommodate further COVID cases? But particularly the lockdown is a big thing.
Sure, thank you. So the question of capacity, the healthcare system is currently able to manage the COVID cases that are presenting. And in some places like Edmonton, the way that they've done that is to stop offering other services. So we do have a limited amount of capacity in the health system in terms of the number of skilled staff, the number of beds. And currently the system is able to accommodate, again, these extra COVID cases by stopping some of those other services. And with the numbers that we've seen over the past couple of weeks, we know that there will continue to be a rise in demand for hospitalizations in ICU over the coming 1 to 2 weeks because of what we've seen historically in cases. However, the question of what happens after that time period, again, rests in all of our hands. And of course, we did put in additional measures last week. And the question of whether or not those measures will be sufficient to bend that curve down so that we do not, again, impact the healthcare system. And I want to underline that point that if we see increasing COVID cases going into hospital, the only way to provide the space to care for them is to stop doing other services. So there's always some degree of trade-offs, and Albertans who need other care could end up having their health conditions worsen as those COVID case rises. So these are all the reasons why coming together over this next time period, pulling together to do our part to stop community spread, to bring those numbers down so that we don't see an ongoing rise in cases. Again, that's in our hands, and if the current measures are not sufficient, then additional ones will have to be considered.
Thank you. Operator, would you please put through the next caller?
The next question is from Don Braid of the Calgary Herald.
Dr. Hinshaw, there was an article in Maclean's magazine just last week, which is rather fiercely critical of you. It's surprising to see, actually, but the argument that was made was that you and all the other medical officers of health across the country have many powers that you're not using because you're in the thrall of provincial politicians. First of all, I'd like to ask if you have read it, and if what your response is, whether you have read it or not.
Thank you for the question. I have read the article, and my response would be that my job description is very clear in the Public Health Act. And the Public Health Act in Alberta says the Chief Medical Officer of Health shall monitor the health of the population and make recommendations to the Minister of Health to promote and protect the health of the population and to prevent disease and injury. So the fact that the job that I am doing is making recommendations is absolutely in line with my legislated role. And I can promise Albertans that I have always, in every recommendation I've made, considered the full health of every person in this province. COVID is a concern, and the other health needs of Albertans are also a concern. And I strive every day to do my best for every single Albertan.
Operator, could you put through the next question, please?
Thank you. Julia Wan, Global News.
Hi, Dr. Hinshaw. ICU beds for COVID patients are filling up, and doctors have raised the alarm about this. They also say that we don't have the time to see whether the measures announced last week are going to work because the situation is so dire. So how do you respond to their assessment? And once we reach and surpass that capacity, what, if anything, can be done?
We know, as I said earlier, that the case numbers that we're seeing today will show up as increases in hospitalization and ICU cases in the next 7 to 10 days. That's very clear. That's been our pattern throughout the course of this pandemic. And so the question of whether or not cases will rise in hospital, yes, they will rise in hospital. And the actions that we collectively take today will determine what those case numbers look like sort of 3 weeks out. And the question of whether or not we implement additional measures today or whether we wait to see what impact those measures last week have. There are no perfect decisions when it comes to COVID. We know that in other provinces, they have struggled to contain COVID. We know that we have with the measures we've previously put in place. The ones that were put in place on Friday are a stronger suite of measures than we have done since the spring. And this is really a call to Albertans to work together to follow those measures and all other public health measures with commitment. And that is the only way that will bring numbers down. And if we don't see a change, absolutely, we will have to put in additional measures.
Operator, could you put through the next question, please?
Thank you. Rafi Butchakanian, CBC.
Hi, Dr. Hinshaw. I'm wondering if there have been any discussions about lockdowns yet in public health, and if you don't want to go that far, would you consider a mask mandate for the province at this point?
There are a variety of options. We're looking at evidence from other jurisdictions around the country and around the world at the measures that have been effective. And of course, many countries have taken slightly different approaches and ended up with a good outcome. So ultimately, again, as I've said before, there's no one single way. So the combination of what those different measures look like, again, hasn't been decided on, but we are looking at that broad range, considering what kinds of recommendations to bring forward. And of course, those measures would all have to be discussed because each measure, again, has consequences, both intended and unintended, and those are the things that need to be discussed and considered.
Operator, please put through the next question.
Thank you. Jeff Slack, 660 News.
Hi, Dr. Hinshaw. Today, 20 deaths. That's a pretty big jump from what we've seen in the past. 14 of those seem to be in community or care homes, rather, sorry. What other measures can you put into place to help protect those elderly in these facilities?
We are working with operators. We're working with Alberta Health Services to try to understand what the options are. We know that the most common point of introduction into the facilities does tend to be staff, and again, staff sometimes who are infectious and don't necessarily know it because they haven't started to have symptoms yet. And so we are working to make sure that in every continuing care facility across the province, many of the measures that have been in place since the spring, we want to make sure that we are not seeing challenges where people perhaps are getting tired or letting some of those practices slip. So we want to provide every support we can to make sure that everyone who shows up, whether they're a volunteer, a worker at those facilities, understands exactly what they need to do. They have all the resources, the tools, and the information to do it. And also that when there is a case identified, that we provide the resources that that location needs to respond immediately and to prevent any further ongoing spread. Unfortunately, because COVID-19 can spread before symptoms start, it makes it very challenging in these places when there's many people living together, but we are working our best with all of those stakeholders to learn from what's happened in past outbreaks and try to put additional measures in place.
Operator, could you please put through the next caller?
Thank you. The next question is from Chris Epp, CTV.
Thank you, Dr. Hinshaw. For months, you have been telling people that you trust them to do what's right. The Premier has gone saying we're not going to enforce our way out of this. We trust people to do what's right. Yesterday, there was 200-some-odd people marching through downtown Calgary, people of all ages, saying the science is fictional, that the orders are fascist, and that this is all a big lie. You've got hundreds of people in a major city close to each other decrying all of the science you've shared with us. At what point do you and the government stop trusting the people, as it were, and perhaps add more teeth to various enforcement measures to get this down?
It is disappointing that there are those who think that the health of our communities is being taken lightly and that these measures are not necessary. I have written a letter to police chiefs across the province asking for their help in enforcing the current measures and doing our best to step up the reinforcement of the importance of them. I will note, I did get an email today that indicated that in Calgary, there was additional inspections over the weekend and monitoring of the requirement to close restaurants and bars at 11 o'clock. And there was significant compliance with that. I think that many operators are recognizing how serious the situation is. And again, referring back to that statistic of 20 people who've died in the last 24 hours, 6 of whom were not in continuing care and did not acquire the disease in one of those outbreaks. And those 14 who were in continuing care, their lives are also not expendable. So I would point back to that. I would point back to the fact that the impacts on the acute care system are going to have impacts on many Albertans who can't get other services that they need if we don't stop the spread. And I will continue to do my best to provide important measures and again, work on enforcement of those measures that are non-negotiable and that are legally required.
Okay, we have time for 3 more questions today. Operator, could you please put through the next question?
Thank you. The next question is from Carrie Tate, Globe and Mail.
Hi, thank you. Dr. Hinshaw, I'm wondering if the contact tracers, if you can talk about the pressure that they're under now that they no longer have to trace every case. How is that load lightening?
Unfortunately, because the number of new cases has increased so substantially, even though not every single contact now gets an individual phone call, there are many, many new cases who need to be phoned. And so our contact tracing teams and our case notification teams still have very heavy workloads. And I would say that from my conversations with those who are leading those teams, I think those teams are still struggling to get the work done in a timely way. We're working together to prioritize, to streamline where possible, and to get those phone calls made as quickly as possible. But those contact tracers, I think, are under still a tremendous amount of pressure. There's still a large volume of work, and I understand that many people who are feeling frustrated about COVID, sometimes when they do get those calls, are unhappy with the contact tracers. So the work is not easy, and they're doing a tremendous job persevering in difficult circumstances. So I would ask all Albertans who find themselves getting a phone call from a case investigator or contact tracer to please remember that they are doing their best for the community and for you to prevent onward spread and to make sure that our most vulnerable are kept safe.
Thank you. Could you put through the next question, please?
Yes, Lauren Boothby, Edmonton Journal.
Hi, Dr. Hinshaw. New cases have doubled in about a month, from about 500 a day to 1,000 now. Active cases are nearly 10 times as high since the end of September. And I think it was about 60% of cases last time I checked had an unknown origin. Given that it's going to take a lot of time to get more contact tracers, and are you confident you can get COVID-19 under control in Alberta? This seems to be spreading at a rapid pace. And if so, how are we going to do that without more strict measures like a lockdown?
We have entered an exponential growth period, and that is, of course, deeply concerning because we do continue to see our growth rate above 1. So I just received the numbers from the analytics team this afternoon, and unfortunately in both large centres, Edmonton and Calgary, in the rest of the province and the province as a whole, we have not even managed to reduce our growth rate to just a flat 1. And even with a small growth rate and many, many active cases, we will continue to see this kind of exponential spread. Now, the R value that was run with our current numbers, it's too soon to see the impact of the measures that were put in place on Friday. And so again, we will watch that very closely. And we do need to consider the fact that because exponential growth means essentially doubling time, it's not like we'll grow from 1,000 to then 1,200 and then kind of slowly over time, that it will grow very quickly. So if these measures that were put in place last Friday are not enough, we will absolutely be bringing forward recommendations for additional measures because we are in a critical time.
Operator, please put through our final question of the day.
Thank you. The final question is from Audrey Nouveau, Radio Canada.
Hi, Dr. Hinshaw. Seeing the cases rising so spectacularly in the last few weeks, can we say officially that we're in a second wave in Alberta?
I would say yes, we are in a second wave at this point in time. About a month ago when we were looking at our numbers, the possibility was still there that we could turn things around and just have sort of the slow burn or small ripples. And clearly that's not what's happened. So I would say yes, it is the second wave at this point in time. But again, it's up to us where that wave peaks and how quickly we can bring it down. And that number is not inevitable. It continues to be in our hands.
Okay, thank you, Dr. Hinshaw. That concludes today's availability. We'll provide another update on Wednesday afternoon. Thank you and be safe.